I'm Luciana Mitsko, and this is Ahead of Dementia. Today we're going to be talking about a topic that comes a lot in consultations with families, which is depression and dementia. Before we explore this topic, let's take a look at our quiz. She's in the moderate stages of Alzheimer's and presenting symptoms of depression, being sad, low energy, and apathetic. As her primary caregiver, what should you do? A. Ignore these symptoms, they come with dementia. B. Look for a psychotherapist specialized in counseling for dementia patients. C. Encourage her to consume more caffeine and other stimulants to get a bigger jolt of energy. Or D. Encourage her to participate in daily activities that are appropriate for her cognitive levels. Wow! Even though there seems to be a correlation between dementia and depression, the relationship is not still well understood. It may be that depression can be a precursor to dementia. Some research have indicated that people who have depression in their midlives are at 70% more risk to develop dementia in later life. And depression is often also one of the first symptoms of dementia, particularly in Alzheimer's disease. It is estimated that 30 to 40% of dementia patients also have depression. However, you should just not assume that depression happens to dementia patients and ignore the symptoms. There's a lot that can be done to help a person with dementia who also has depression. But the thing that cannot help is psychotherapy. This is something that a lot of people would naturally think. You have depression, therefore let's find you a psychotherapist. You have dementia and depression, let's find you a psychotherapist who is specialized in dementia patients. Now, psychotherapy does not work in dementia patients. The problem is dementia patients very often have problems with short-term memories, and psychotherapy works by administering a series of techniques that are meant to build on one another, to create resilience, to create coping skills, to boost a person's self-esteem. So you need to have a sequencing of strategies with the help of psychotherapists. In dementia, you can't do that because when they come for the second session, they have forgotten what happened in the first session, and the psychotherapy fails. So if you find a psychotherapist who is specialized in dementia patient, beware. This is not a possibility. And on the other hand, dementia very often erases all the benefits of years of psychotherapies that a person may have had in the past, because it starts erasing your memories from the first recent to the later memories, and those years of psychotherapies disappear. The strategies to help a person with depression when they have dementia involve working in the environment and working in the daily activities. Many times boredom leads to depression, and many times the lack of stimulant activities and things that you feel good doing, those are the things that make the depression worse. And I'm not saying let's add caffeine and other stimulants to make a person feel more energetic. Actually, caffeine is one of the first things I ask family to absolutely cut from the diet when a person has dementia, because it may cause so many other problems. It is associated with lack of sleep. It is associated with agitation and it's also associated with incontinence, all things that you don't want to have anything to do when you have dementia. One of the best things that you can do to help a person with dementia who is experiencing depression is keep that person occupied with activities that are appropriate for their level of cognition. So you would find activities that are related to their best interests. Let's say a person liked hiking, a person likes sailing, a person likes sports. Of course, they cannot practice none of those anymore, but you can find videos, you can find activities that are related to those topics and introduce that in their daily routine, keeping them occupied with activities that are appropriate cognitively for their present levels of abilities is the key to keep a person happy and content in dementia. One of the best ways of doing it is finding a day center, a daycare center in your area that has activities for people with dementia. Daycare centers are wonderful in devising activities that are meaningful, significant to the person with dementia, and also that they feel successful. They feel that they have accomplished something, which is so difficult when your mind is not able to perform so many of the activities that we take for granted. The reasoning, the organization, the planning, the things that you need to do to perform successfully any activity, and they find so difficult to get there. It is our job as caregivers to devise those activities, present to our loved ones, and encourage them to participate and be successful. This works really well with people with dementia who are experiencing depression. So by now, you know the answer of your quiz. The best answer is D. Encourage her to participate in daily activities that are appropriate for her cognitive levels. We can never discount the changes in personality that come with dementia, and we have always to adapt the dementia care and the strategies to the person who they are now, not who they used to be. From who they used to be, we take their interest, we take the things that used to make them happy, and then we pick those things up and adapt to their current levels of ability. That's the key to successful dementia care. I always like to start addressing any issues related to dementia in the household with activities, or maybe with nutrition or exercises in a way that is holistic, considering the whole person. But also keep in mind that there are many ways the doctors can help, and there are medications that can help with many of the behavior and psychological symptoms of dementia. In the case of depression, there are antidepressants that can be used successfully to help a person with dementia. As with any medications, please ask for the side effects, counter interactions with other medications, be informed. Talk to your doctor and ask all the questions before starting any medications. Thank you for watching, and I hope to see you again for another chapter of Ahead of Dementia.